Welcome to this week's Today's Health and Wellness podcast. This is Brett.
And I'm Ashley. The Today's Health and Wellness podcast is a joint effort of the Central Ohio Health and Wellness magazine and Today's Health.
In each week's podcast, we spotlight health and wellness stories you'll find in the magazine, on Today's Health web pages, our social media, as well as extras you'll hear only in the weekly podcasts.
Thanks for subscribing and hitting the play button. Let's get started.
In 1987, Fountain Institute, a 501c3 nonprofit organization, was formed by Sandy Kraemer, a Colorado Springs attorney, to research intergenerational issues. The resulting research identified the need to set aside a time each year to focus on intentionally connecting generations to better communicate age-related gratitude and needs. Why are we spotlighting this? Well, September is Intergenerational Month. Health issues within the family can be stressful, and one of the most stressful can be Alzheimer's. Part of living well with Alzheimer's is adjusting to your new normal and helping family and friends do the same. Knowing what to expect and what resources are available can make the process easier for you and those close to you. We got to speak with Anne Farley, Communication Relations Director, and Deborah Taylor, Director of Marketing at the Ganzhorn Suite Specialized Memory Care, about how important it is for families to discuss how they'll prepare and handle a family member's dementia diagnosis and care. How important is it for families to discuss how they'll prepare and handle a family member's dementia diagnosis and care?
I think it's incredibly important, just like any major decision that families make together, whether it's planning a wedding or some other rite of passage. I feel that planning for someone's impending placement after a dementia diagnosis is incredibly important. There are a lot of choices out there. There are a lot of moving parts that people need to think about. And I think if you are doing that prior to a crisis, when you're not running in panic mode, that it's a much better fit and feel for the families.
How can families prepare for the changes that'll be happening in due course of the disease, Deborah?
I think the best thing to do is to really arm themselves with as much information as possible. First and foremost, it's so important to get a definitive diagnosis. Oftentimes when people experience confusion, they might jump to the conclusion immediately that it's dementia, and it may or may not be, but first and foremost, getting to a neurologist, and that is the specialist that would do a diagnosis, finding out exactly what type of dementia, and then arming themselves with as much of the latest research as they can, talking to other friends and family, engaging with the healthcare community so that they can, as Anne said, really become familiar with all of the resources available and put together a plan so that if the time comes that they need more than just care from perhaps a family caregiver, they can figure out how they will access that, whether it's home care or a center or what have you.
What resources are available before contacting you that can help with this progress, helping the family move to the right direction?
I think probably one of the most common ones is there are lots of local chapters of Alzheimer's associations. Of course, here in Central Ohio, we have the Central Ohio chapter, and then there's also a Delaware County chapter of the Alzheimer's Association. I think that's a great start. And then I think there are just other resources around, such as your family physician or your neurologist or friends or other people that have gone through this, and reaching out to them and finding that information out. Maybe it's a pastor at your church. Maybe it's getting involved in some type of a support group. But I think there is a lot out there, but families, again, may not know how to access it. And that's where I hope that, we can come in to play, because I feel like we're a really good resource for this area.
Yeah, I was going to say that there aren't many families that you run into that have not been affected by this. I think that could be the first go-to. Again, it's very hard not to think about families in church and such like that that's been affected.
Right. Absolutely. I mean, I don't think you could ever find a group of people where someone has not been affected, whether it's a neighbor, a family member, someone else they know, coworker that has been touched by this. And I think it's a great place to start. Tell me what worked for you. How did you start this process, especially if it's someone you trust?
And what's so difficult is each patient's different.
Oh, absolutely. No two people have the same journey. Even if the two people have Lewy body, or they've both been diagnosed with frontal lobe, whatever the type of dementia, everyone's journey is different because there are different family dynamics. There are different financial abilities. there are just so many different moving parts for people.
What does the Ganzhorn Suite specialized memory care offer for family and the patient?
Well, what we have here in Central Ohio is something that's very different in terms of a setting, if you will. So first and foremost, we have what we call a purpose-built design here, which is more of a household model, if you will. So at Ganzhorn, we have 4 separate households. Each one can accommodate 16 residents, and then each household is really dedicated to a different stage of dementia. So all of the care and services within each household is truly customized to that stage of dementia. And then beyond that, we have very robust medical care here for an assisted living. So extremely high staffing. We staff at a 1-to-5 ratio. And we've done that because we truly understand that you need to have enough staff and the right staff. And when I say the right staff, Brett, to us, that means someone who's had in-depth training for dementia services. So everyone on our team has to become a certified dementia practitioner. And what that means for our residents and families is that they can rest assured that they are getting the highest level of care with people who truly understand dementia and the disease process. And then finally, we are very fortunate. We also have a neurologist as our medical director, and that is Dr. Douglas Shari from Ohio State University. He's actually head of neurology, and he's also the director of the Memory Disorders Clinic at OSU. So he does come on site to treat residents as well. So it's really a combination between that medical model of care, having enough people and the right people and the credentials, and having that purpose-built design that comes together really to help support independence in a group of people that are struggling with independence due to their memory disorder.
Can family members visit and talk with a Ganzhorn Suite certified dementia practitioner to help themselves out?
Yes. Any family is welcome to stop by our community. What I want to stress is whether we end up being a fit for that family or not for a variety of reasons. My biggest mission, as well as our team, is that we're a resource. So we have support groups here. We have educational programs. We have caregiver events. I want people to feel like we at least are a resource for them if we're not something for them long term.
How can they contact you?
They can call our main number, which is 614-356-9810, and ask for anyone on the team. If they want to ask for me, that's fine. I'm the Director of Community Relations. They can visit our website at www.ganzhorn.com. We have a very active social media platform. So there are just a variety of ways. Or they can just stop in.
Thanks again for listening to this week's Today's Health and Wellness podcast, brought to you by Central Ohio Health and Wellness Magazine and Today's Health. If you have a health and wellness segment you would like us to cover, send us an email. Our contact information is in the show notes.
And if you'd like more information about sponsoring our podcast, like Ashley just mentioned, our contact information is in the podcast notes. We look forward to hearing from you.
Circle270media.com